Hey guys, I'm Amy Capel, and cultural fads have always fascinated me. The most recent cultural fad that's caught my attention is parents who choose not to vaccinate their children. This fad comes with some pretty hefty consequences, as we've seen it in Disneyland, California, with a measles outbreak that has affected 102 people in 14 states. And while most of us accept the doctor's advice to get vaccinated, there is a growing number of people who do not. There's some big reasons for this, mainly being a belief that vaccinations are linked to autism, that vaccines are part of a pharmaceutical scheme, and that vaccines are full of poison and are unnatural. But the most interesting thoughts about vaccinations that I've come across are from parents in Ashland, Oregon. In Ashland, Oregon, if you choose not to vaccinate your children, you have to sit down with a public health official and discuss the reason why. The public health officer will warn these parents what will happen to their children if they're infected, but also that by not vaccinating their child, they leave those who cannot receive vaccinations because of age or compromised immune system vulnerable as well. And even after learning this, the parents still have the mentality that it can't happen to us. We see this attitude in other states as well, such as Washington and California, and health public officials believe it is because parents of this generation haven't seen the deadly effects of diseases like polio and rubella. But regardless, the most interesting factor I have discovered in this research is that people who are anti-vaccine tend to be grouped into the same geographical locations. Hotspots for not vaccinating can be localized to states, cities, counties, and even school districts. So there seems to be some sort of cultural factor at play into people's decision to vaccinate. And it's important to know that other social determinants like race, education, and socioeconomic status are not a part of this decision to vaccinate. So the deeper I got into this research, the more I began to wonder about legislation related to vaccinations. Well, in 1905, the Supreme Court ruled in Jacobson versus Massachusetts that states can enforce vaccination laws, but that exemptions can be given for certain medical conditions, such as an allergy to a product in the vaccine. Currently, there are so many people who aren't vaccinating their children because these exemptions are easier to obtain and can now be given based on personal belief. In most states, it is moderately difficult to get an exemption because a professional healthcare provider's signature is needed on the exemption. However, in other states, all that is needed is a parent's signature. And as you could guess, states where exemption rates are easiest to obtain have higher incident rates of communicable diseases that are preventable through vaccinations. So how do we fix this? Well, education is not working. Health officials have gone to these hot spots and have talked to parents, like in Ashland, Oregon, and immunization rates are not increasing. Parents are not backing down. If we really want to protect our states and communities, legislative policies need to be implemented to enforce vaccination laws. And some states are catching on to this idea. Most recently, California has proposed mandatory vaccination laws in public and private schools, and the only medical exemption will be a true medical threat. So even though legislation is proven to increase vaccination rates and thereby decrease the possibility of outbreaks, only 7 states in the past few years have made exemptions harder to obtain, while 12 states have made them easier. There's much debate among politicians, especially those in the upcoming election, about the government's role in mandating vaccinations. Mandating anything is a hard pill for Americans to swallow. But regardless, unless the government imposes on individuals to get their children vaccinated, the CDC is worried these outbreaks will continue and grow. States will suffer monetarily, communities will suffer, individuals will get sick and even die from completely preventable diseases. The best action is to implement laws to mandate vaccinations, make exemptions harder to obtain, and the only exemption should be a true medical threat. These laws, if implemented, will break the incultural fad of not vaccinating and will prevent the spread of morbidity and mortality for diseases that have already been eradicated in the United States. Thank you.